Okay, good afternoon, everybody. I see folks starting to trickle in, so thanks so much for joining us. Hello, everyone. Thanks for joining the National Academy for State Health Policy for our webinar, State Strategies to Lower Funding Barriers for Community-Based Organizations. We're just getting folks a chance to settle in, but just to get us started, welcome. My name is Katie Green. I'm the Director for Population Public Health. And among other issues, my team at NASHB focuses on substance use prevention, treatment, and recovery policy topics. Our work is generously supported by the Foundation for Opioid Response Efforts, and this project was also done in collaboration with the American Institutes for Research, Center for Addiction Research and Effective Solutions. Next slide. Okay, just a few quick logistics before we jump in. Throughout the conversation today, feel free to submit Q&A through the Q&A function. We'll reserve some time at the end to talk about them. Also, just note today's slides and recording will be posted on NASHB's site, but appreciate you being live. And again, just use the chat function on the bottom to ask any questions, and we'll get to them in discussion. Okay, next slide. All right, so just to provide a little bit of context about our conversation today, as most folks are probably aware, even though overdose rates have gone down nationwide, many communities still continue to see rising rates. Opioid settlement funds give leaders an opportunity to really focus efforts and resources directly to where they're needed most. And one of the most powerful ways to do that is by working with community-based organizations or CBOs. These are groups that are deeply rooted in their communities and are trusted by the people that they serve. They're really essential partners in delivering tailored services that help reduce the risk of overdose. And one of our recent projects focused on identifying policy options and examples of how states are really working to better support that CBO work. Next slide. So we are going to kick off conversation day by introducing our new resource, which features strategies for how states can better partner with community-based organizations to reduce overdoses. It is full of great practical strategies for how states can really work to lower those funding barriers that CBOs often encounter in the grant-making process. So our presenters will share some of those success stories for supporting CBOs, and give you a snapshot of what their work looks like on a day-to-day basis, and we'll have lots of time for conversation at the end. So again, please do make sure to submit those questions throughout. Next slide. So just jumping to the resource here, this toolkit was really born out of a challenge that we kept encountering for state leaders working to distribute opioid settlement funds. And though these challenges are obviously felt across all state agencies that are working to administer funds and work with communities. And even though CBOs are doing vital work across health and social services, accessing state administering funding can be a frustrating challenge for a whole lot of reasons that I'm sure folks have encountered. To understand this issue better, NASHB convened a group of bipartisan leaders, CBOs, and community engagement experts to bring discussion and talk through what might be some approaches to funding and support at the forefront. So what really resulted from that is a set of 8 successful strategies for state leaders to consider for streamlining the process of getting those resources to CBOs. The toolkit is also designed understanding that states are operating in different situations. So you can take or leave all these strategies. Some of these solutions include addressing challenges in the grant-making procurement process, improving accessibility of information, funding and opportunities, and building community engagement into the grant-making process, just to name a few. So in each of these strategies, we offer several levers, excuse me, several policy levers, state strategies in action, and some really practical considerations for implementation. So here's just a quick snapshot about what some of that content looks like, and dives a little bit more into the details of how you can implement some of these options. So definitely encourage you to take a look at this toolkit. It is rich and detailed. And if there are ideas that you'd like to talk more about, please don't hesitate to reach out to any of us here at Nashville, and we'll find some time to talk. All right, next slide. Now, though, we want to hear directly from some of the states who contributed to this toolkit. Do we have Julia on the line yet? Or okay, should we start with Julia?
Can you hear me?
Yes. Okay,
Okay.
great. And I'll just go ahead and introduce you. Sorry, I know we had some technical difficulties. So we've got Julia Newhall, who's the Director of Opioid Abatement Strategy and Implementation at the Massachusetts Department of Public Health, Roberta Branick, who's the Program Administrator for the South Carolina Opioid Recovery Fund, and Chris Teeters, who's the Assistant Attorney General at the Office of Kansas Attorney General. So very much like to thank everyone for joining us here today. And Julia, if you're ready, I can turn it over to you.
Sure. Can I share my screen, or how can I do that? Let's see. I just sent you a request to share screen.
Okay. All right, you should be all set.
Okay, perfect. Okay, can everybody see my screen here?
Yep.
Awesome. All right. So thanks so much for inviting me today. My name is Julia Newhall, and I am the Director of Opioid Abatement at the Massachusetts Department of Public Health. Today, I'm going to be talking about the Mosaic Opioid Recovery Partnership, which is Massachusetts grant-making initiative for its state opioid settlement funds. So in Massachusetts, we have a state subdivision agreement, which really governs all of our settlement spending. We have a participating municipalities and an opioid recovery remediation advisory council. 40% of our funds are allocated directly to the municipalities, and 60% is allocated to the advisory council. We're anticipating receiving just over $1 billion over the next 16 years. So the ORF Advisory Council is comprised of cross-sector members, public health experts, providers, people with living experience per our statute. And when the Advisory Council was formed, they developed some state level principles for guiding how the settlement funds would be expended through the council's guidance. And I won't go through all of these, but the one that I wanted to point out is ensuring equitable access and disbursement to achieve long-lasting community-driven change. And this is really where our community grant-making initiative comes in. So in 2023, the Advisory Council approved a community grant making program with an overarching goal of providing an accessible pathway for community-based organizations and municipalities to apply for that 60% state portion of its opioid settlement funds. In total, that is 18% of the principal that the state will receive towards its 60% portion. When we were thinking about developing this program and implementing it, we really put a lot of time and effort into considering whether this should be a state-led program or whether we should procure out to a vendor. And looking at the pros and cons, we felt that obviously accountability and oversight would be a pro for us, really having some cost savings through administrative costs, and really aligning with our strategies and our priorities. However, the cons of implementing an in-house program included bureaucratic complexities, inequities in access, limited flexibility around evolving and adapting the program as needed, and just really innovation would be a hurdle for our state procurement system. So ultimately, we did decide to procure our grant making program out and went through a regular procurement process for doing so. This was our timeline for planning and implementation. As I said, the council approved the grant making program in 2023. We released our RFR in November. We held a review training for consumer advisory boards because we really wanted them to be part of that conversation and help us identify the right vendor to oversee a community grant making program. The community grant review took place in January, and then we had a leadership review in March, which looked at different factors such as diversity of the organizations that applied. We wanted to ensure that they had the subject matter expertise, that they had people with living experience on their employment, and ultimately we selected RISE Massachusetts, which is a funder that is solely dedicated to really addressing the overdose epidemic. The only organization that applied that is their sole mission. They focus primarily on opioid-related overdose epidemic. And we launched the program in April of that year, which was coined Mosaic Opioid Recovery Partnership. The goal of the partnership is to have a unique private and public collaboration between the state and RISE to support initiatives that have been historically underserved and have experienced high rates of opioid-related overdoses. This is really our North Star for deciding which organizations to fund as we think about our community grant-making project. These are the core principles that we came up with when Mosaic was launched. We include voices of people with lived and living experience in all our decision making. We ensure that equity is embedded in everything that we do, and we have a commitment towards inclusion. We try to reduce stigma by looking at our language and just the materials that we put out, whether it's to grantees as well as on the website or any other promotional materials. And then we advocate for, person-centered, looking at support, choice, and autonomy of individuals in the work that we are funding. Core elements of the Mosaic program include capacity building and sustainability, developing and mobilizing equity and access, integration and collaboration, and accountability and impact. Capacity and building and sustainability are probably the primary goal of our grantees is to focus on helping them build up their capacity to sustain these programs beyond the duration of the grant funds. And a lot of the organizations that we are funding are small organizations, community-based organizations that have, operating budgets under $5 million. And one way to do that is by funding programs not just that are, subject or focus on a particular care continuum, but really general operating cost, which is one of the things that we prioritized early on. So these are the 3 grant programs that we funded over the first year. Our first was the community-based opioid response core grant. It's a 3-year grants for a total of $3.75 million. We funded 18 organizations, and the range of those awards was from $50,000 to $150,000. As I said, under unrestricted funding that could be used for any purpose, including paying salaries, utilities, expenses, really trying to help them build their internal capacity to, provide and bring their services to scale. The second grant was a municipal matching grant, which is 3 one-year grants for a total of $1.485 million. We funded 75 municipalities and nonprofit partners. So municipalities are able to select a nonprofit partner that they want to match the Mosaic portion with their municipal opioid settlement funds. And this year, unlike in the previous year, we have a 2-track model for the municipal matching grants, which is really based on the readiness. We're trying to have municipalities invest in their own capacity and implementing any sort of strategic planning to ensure that they're not just selecting strategies based on, whatever they think is, anecdotal data, that they are taking the time and the resources to ensure that they're implementing data-driven strategies. And then we have our earlier adopter municipalities who are, well ahead of the others, who are already doing, the work and thinking more on an innovative scale rather than at the early stages. And then in round 3, we have our Family Resilience Grant Program, which is the biggest grant out of all 3. It was for $7.5 million. We awarded 8 organizations as funding, and this is really our only programmatic grant, which is to deliver comprehensive support services to families to improve child well-being and to strengthen community resources within this space. It's something that we have heard a lot from our community-based organizations, that they want to be able to provide supports that are not billable, that aren't traditionally funded. And so we thought it would be best to ensure that we had a particular grant program for this model. So the application process was something that we put a lot of time and effort into to ensure that it was as low threshold as possible. It is a online survey that's super easy to complete. I think the first core grant, the smaller organizations, there was a total of 8 questions on there. We did Q&A sessions and we held office hours. We do that for all of our grants, all rounds of grants. But we also do one-on-one technical support prior to community-based organizations submitting their applications. So we can walk them through, any sort of issues that they may have around getting the financial documents that they need in place, or answering questions around budgeting, or even helping them develop their mission statement or their vision statement, things like that. So we take the time ahead of them submitting their proposals to give them a fair opportunity and be able to compete with others. And then another big factor is pushing out the deadline to 12 a.m. rather than a normal 5 p.m., which made a big difference. We had, I think, 20% of the proposals that we received were after 10 p.m. in the evening on the day of the deadline. And then all of our applicants are surveyed to really get a better understanding from them how easy it was to fill out the application. Were they able to get the information in time? Did they have the ability to answer the questions to the best extent that they could, and things like that, that we really take that input that we receive from them to adjust our processes in the future. Our review process includes an eligibility review, which is done at the state level. We look at things like the grant requirements, compliance with our state subdivision agreement, and then we also make sure that there isn't going to be any issues around supplanting. So we look at whether any of the organizations are funded by other programs that the state funds to ensure there's no overlap. Our community review process is probably the most thorough. We have three groups of people who sit on teams that review every proposal that comes in. They have to be people with lived and living experience and subject matter experts. All of those individuals are compensated. They're also trained prior to participating in a review process on scoring and reviewing applications, which has been super helpful. And then we do finally an internal review looking at opioid-related overdose data and the social vulnerability index. So there's an evaluation plan for all 3 rounds of grants, but mostly we look at it from a larger scale. We're trying to understand, the more process related things in terms of grant implementation, and not coming up with, long-term outcomes as far as impact at this point, because we're really in the early stages of this process. The goal of this program, again, is to make an accessible pathway towards providing access to these grant dollars. And so that is what we're trying to focus on. How well are we doing that? What else can we be doing to make that process easier for our CBOs? We have primary sources of data that we look at our annual grantee reports. Again, the surveys that the grantees we're asking them to complete when they are applying for our grants. We have qualitative interviews and focus groups with grantees and any stakeholders that participate in the process, and then also through participant observation as well. All of our grantees are offered training and technical assistance, and one thing that's been beneficial is that we don't just stick to the grants themselves. If they need technical assistance beyond what is included in their scope of work, we provide that technical assistance to the CBOs, because so much of their work overlaps, and oftentimes grants are really silo work, and we understand that they're working from a different lens. So we try to provide as much training and technical assistance as we can that is really, scaling up their work overall, and not just based on what they're getting funded through the Mosaic program. We have grantee webinars and learning communities. We do a boot camp for executive directors from the CBOs, a lot of network building. We had an anniversary event last week to celebrate the first year of the Mosaic program, which include reviewers, grantees, funders. It was a great event, and we got to hear a lot of great success stories from our small community-based organizations who are doing such awesome work and have received a lot of guidance and support to bring their visions to fruition. And then all of this is voluntary. We don't require that these organizations utilize the TTA services. It's really an opt-in program, and we try to meet them where they're at. Not every organization is going to have the same level of needs, and we understand that, but we do provide a wide array of services, which could be anything from strategic planning to developing their business plans, helping them identify goals and objectives, working on things like promotional materials, marketing, communication, and also looking at more large scale things like equity, and ensuring that they are providing services in a way that is evidence-based and in compliance with any state subdivision requirements. So I'm happy to answer any questions that folks have, but I'm sure you'll want to pass it on to the next state first.
Yeah, thanks so much. There was one question in the chat, just if you'd be able to share a copy of the grant application. So, okay, great.
I'll send it to you, and then you can send it to the group.
Okay, sounds great. Thank you so much. Really
Sure.
fantastic information. Appreciate you walking us through the process on that. And at this point, we will turn it over to Roberta to talk about what's going on in South Carolina. Okay, you're on mute.
Sorry about that, talking away. Good afternoon, Roberta Braddock. I'm coming from South Carolina. I'm the program administrator for the South Carolina Opioid Recovery Fund Board. Next. This is our board. So here in South Carolina, we're a little bit different at every state, right? I can say that we're doing it a little bit different. So this board is actually a quasi-governmental agency. And they are charged with dispersing the funds out into the community in alignment with the settlement. I'll talk a little more about that as well next. And I should say we have doctor, nurse, lived experience, county administrators, and municipal leaders. on that board. So in South Carolina, 85% of the funds go to what's called guaranteed political subdivisions, and that is the counties and the municipalities. And then 15% is our discretionary sub fund, which anyone can apply for, all the way down to the individual state agencies, hospitals, mental health providers. It's open to anyone at all. I was just pleased. Yesterday, I got a phone call from a man that works for Piggly Wiggly, and he's been calling me for 2.5 years. He's a member of a 12-step recovery program, and how could he get money and get into the community? And he went out and got hooked up with a organization for youth in the Low Country here, the Low Country Alliance for Healthy Youth, and he recently received funds through that organization to work in the community. So when we look at like that, literally this individual just that works at a Piggly Wiggly, wanted to get, do something about this and didn't. So that was pretty exciting. But so the guaranteed political subdivisions, they are allotted money based on population, overdose data, a variety of factors. And they have an allotted percentage that they get year over year. And then the discretionary sub-fund is the 15% that's left. For discretionary sub-funds, we give about $8 billion out a year. This year, we topped giving out $40 million. So very excited about that. Go ahead to next. So for our application process, for the guaranteed political sub-funds, they have a very simple application process. It has 3 questions on it. And then what's your strategy from Exhibit E you're required to use? What's your plan to implement that? And what is your budget surrounding it? It's pretty simple. And then for the discretionary sub-fund, that's competitive. That application's a little bit more complicated. It has a scoring matrix. So the board scores, and then they get together and they discuss and they award. They take the word discretion literally. So even though they score, they whoever scores a 50 and whoever scores a 5, you might score the 5 and get the funds because you might be an organization that didn't know how to write a grant. So they try to kind of look through that, and I'll talk a couple of slides now down how we're actually trying to make that better. But I wanted to show this because I'm proud to say in 2025 for the guaranteed political sub-funds, and we still have one more application period that's happening right now. We've had 74 applications. 28 of those are where the government, the municipality or the county gave the money directly to a community based organization, right? So they just gifted it all over and they're, kind of out of the process of it. And then we have 27 that are kind of straight government, and most of those government are police, fire departments, detention centers. And then we have where government partnered with CBOs. So say, for example, the government is doing a post-overdose response program, and they partnered with a recovery center and share peer support for that post-overdose program. So kind of something like that with the government and the CBOs, a variety of combinations. But like that, we have one. Some of you may have heard. We have Muffin the Horse is gaining popularity. We have Muffin the Horse. That was a fire department that partnered with a private citizen who has a horse that they bring around and do a lot of opioid-related work for education and recovery. They do things like go to domestic violence shelters, go to schools, and of course, people are very engaged by the horse, and it really helps the speaker to be able to give out the message and keep the attention, especially of kids. And now they're starting to move into actually doing for that equine therapy. So that's very exciting. So we're proud of that for our guaranteed political subdivisions. And then for our discretionary awardees, we've had a little bit of an increase. We're working hard to even make it more, but community-based organizations versus government hospitals or universities. So you can see here in 23, we were at 9 and 7, then a little bit better in 24. We were at 10 and 5, and then kind of hovering this year. with 9 and 6. So I'm hoping that next year, after we're actually changing the way we do the discretionary sub-fund, which I'll talk about in a little bit, that we see the community-based organizations have a higher number. But proud so far in these first couple of years that we seem to be kind of getting the word out into the community. Next. So some of the ways that we try to get that word out into the community. What we offer for our guaranteed political subdivisions is, so they have to apply for the funds, a whole lot of technical assistance, which I'll talk about, and then it goes to the board and the board approves it. So what we did was we took that out, that whole process out, and made a letter of intent. If you want to do a community action plan, you can just send that letter of intent over here to my office, and we will immediately issue you the money. It doesn't have to go before the board. Because we want people to do community action plans in order to understand, right, their community better. That they would use data to understand the opioid crisis, that they would assess the existing infrastructure, and seek input from the community, having family members, caregivers, community-based organizations, advocacy groups, individuals with lived experience, to be able to ensure, understanding of all of the challenges and the opportunities of the community, and then execute, right, a good strategic community plan tailored to those local regional needs. So we've had some really good success with those. We've had about 22 of them going on in the community. And we have a coffee chat, which I'll talk about on the next slide, where we've had the members who have created the community-based plan come on and then share how they do it for others to be able to learn. So that's been really exciting. But this has been very helpful especially for with the government. So many of the counties and municipalities initially were like, we don't know what to do with this money, right? We don't know how to put this into the community. So when we offered this, and it was making it easier for them to not have to go through the application process and encouraging them by just basically handing them the money to do this, they learned a lot, right, about what went on in their community and how to better manage it. The only requirement for this money is that in 6 months, they send to us the community action plan. So, we have those on file. So that's been pretty exciting. Next. So some of the things that we are doing to help the community-based organizations and everyone, right, but the community-based organizations especially, because we want this money down in the community of people that have boots on the ground, is that we have a monthly coffee chat on the first Friday of every month. From 9:30 to 10:30. It's just an open meeting. I often have a variety of topics, special speakers, announcements, and sometimes just open conversation. And then we have on-demand technical assistance. So there are 2 of us here at this office, and the technical assistance is the majority of what we do. We answer the phone all day, do email all day, and end up doing impromptu virtual meetings as well as scheduled virtual meetings. We'll get someone on the phone that's saying, I am having a hard time with, adding something in the application. I'll say, well, let me send you a Teams meeting and we'll share screens so I can see exactly what you're doing and help you. So we do, when I say we do that all day, every day, that is our job. We do that all day, every day, on top of everything else. But that is our priority, is to be here on demand for the community. And then we have this online access to information. On our website, we have this forms reporting information and general information. And, through a lot of feedback, through a lot of thinking about things, but we have a whole array of forms. For instance, we just implemented a grant management system. Before we were kind of doing everything on paper. And we made a partner template for that, right? So we have a PDF fillable form that mimics the application online so that the counties or municipalities can send that out to their partners and have their partners not have to be working in the system. They can do it all out on paper, hash it all out on this form, But then when they go to put it in the computer, they can just cut and paste it right in because it mimics the form. So, try to make things as easy as possible. We also have things on here like our guidelines and unallowable expenses. So that people can know ahead of time what they can ask for, what they can't. We have travel and training expense information there. We do encourage trainings. We allow for one out-of-state training per project period. Our project periods are 1 year. And as many in-state trainings as you want to go to. So we have the guidelines there for that. And then we also have capital request guidelines. For anyone who is looking for any kind of capital investment, looking for a building or for purchase a building or a large renovation of a building, we have the guidelines for our capital investments there. And then we have the Center of Excellence. The Center of Excellence is in partnership with the Department of Alcohol and Other Drug Services, which just changed their name to the Office of Substance Use Services. So I have to get used to saying that, the Office of Substance Use Services. The Center for Addiction offers free consultation with referral for technical experts for developing and implementing the abatement strategies. They help with community planning and administration of these funds. We really look to them for once the application is approved, for the implementation, right? Now you had the idea, you made a plan, now how do you put that plan into action? So we really look heavily to that. And the Center of Excellence has been an amazing contribution to us and to the state in supporting these opioid funds. Next. So on our Friday morning coffee chats, these have been a really great way for us to connect with the community, to understand the needs of the community, and then helps us to be able to develop different plans, different policies, different forms, different types of technical assistance. So we've done a couple of sessions on the community action planning. We had partners come on and share their plan. South Carolina has a naloxone dashboard, but for the naloxone saturation plan that was required at the state opioid response funds to be done. So with that dashboard, we encourage everyone as they want to ask us about naloxone, right? Whether purchasing naloxone or developing strategies, right? That they review the dashboard so that they know what's going on in their area and their regions. Of course, some areas would have that are oversaturated, some would have that aren't saturated enough, right? So this dashboard really helps that. We have had sessions on dividing an evaluation plan to measure the effectiveness of the state opioid settlement funds. We encourage the communities to do that. We are going to do that at the state level now as we go into our 4th year. We're going to have a larger scale kind of evaluation plan to begin to look at the impact. OD maps, I would imagine most states have some kind of OD map, data real time. So we've had that. We've encouraged everyone to sign up for that so that they can also look at that in real time to be able to see what hotspots are. We have some small community-based organizations that go right down into those communities as those kind of hotspots are happening. We have a gentleman that I love this man. He started off a few years ago where he was literally doing these things out of his trunk. Syringes and naloxone and xylazine test strips and all those things. And now he's actually has a full mobile unit and a brick and mortar. Right. So that's been super exciting to see that growth. And how he started with that trunk of his car with the OD maps and now has evolved. We had a really excellent presentation on wound care. We have some harm reduction community-based organizations that are, literally in the street, helping people with wound care who, are struggling and would not otherwise have access to get these wounds cleaned and wrapped, and then of course, get the education and then begin the support of the organization. So those coffee chats have been really exciting and really valuable, I think, both out to the community and for us as we learn, what the community needs are and how we can better support them. So that's been exciting. Next. So our discretionary sub-club application, this is something that we're just going to be doing in our next round, which opens up in April. So our discretionary sub fund, if you remember, is 15%. We give out about 8 million a year. Actually in 2030, that goes to 50% instead of 85-15. So the discretionary fund will get bigger. But what we were finding was that, universities, right, researchers, hospitals, state agencies, they know how to write grants. They hire professional grant writers. And then we would have, the community-based organizations that would come in. And I mean, they just don't know how to write a grant. They haven't done them before. They're new to, kind of searching out for money, especially if they're a newer organization. And you can see the difference in the applications. And while the board, uses the scoring matrix and has been really cognizant and worked hard to get that money out to the community-based organizations, they could see that there was kind of this, competition between them. And our thing was while we give tons of technical assistance to the guaranteed political subdivisions, for the guaranteed political subdivisions, because it's non-competitive, when they submit an application, before it even goes to the board, we review it here in my office, and we call them and we say, we don't think that the board will allow this, or we think that we need more information on this, right? We get it ready for the board. Where with the discretionary, we couldn't do that because it was competitive. So what we decided to do was kind of like a bidders conference, right? We're calling it a pre-application meeting, where we will clarify all of the requirements, right, about the, applicants who ask questions about abatement strategies, project scope, technical specifications. We want to ensure fairness. We're holding this meeting for all potential applicants to ensure that everybody receives the same information at the same time. But we're hoping that it will improve application quality by having a better understanding of the requirements. So that, the community-based organizations, especially the really small ones, can submit a more accurate and competitive proposal. And then also that this would provide a networking opportunity, right? That people might meet people on this call or see resources on this call that they never knew about before and be able to come together better. So we will, provide presentations on the information about the application. We will have a question and answer session, and then, certainly allow for follow-up questions as we move forward. So this will be the first time we're doing that. We're hoping that it brings that gaps, down a little bit between what your university presents, and what your community-based organization presents. So we're excited for that to happen. Next. And then this is just an example of some of our projects. We're, proud of getting this stuff out into the community. We have a woman that has a very small home. I think she's got 4 or 5 bedrooms, and she takes in women post incarceration. Specifically, she works with people with substance abuse and sex workers that have been incarcerated. And brings them into this home and has a wonderful recovery program. So we were super excited that she was able to get funded. But we're funding, of course, medication assisted media campaigns, a lot of faith-based programming, which I've been very happy to see here. That we have a lot of faith-based programming happening. Many of you know the statistics. Something like only 11%, there's some low number like that of people that need treatment will actually walk into a substance use facility. But many people will go to their church, especially here in South Carolina. It's a very faith-based community, and super excited to be able to get a lot of faith-based programs on board. Our harm reduction here is growing. As I said, we had this gentleman working out of the trunk of his car, and now we have 3 or 4 brick and mortar solid kind of harm reductions throughout the state, and we have a large South Carolina harm reduction coalition. So that's been really wonderful. And then peer support has grown unbelievable here. For years ago when I worked in the field and I worked in a large regional hospital, we had a huge, first psychiatric program, and that was the peer support, right? Peer support with mental health. But that model has transitioned so well into the recovery community. And seeing more and more of that peer recovery support as it pertains to substance use has been super exciting. So we're glad to be able to support the growth of that here in South Carolina. And I think that is it. Great, you have questions?
Okay, thank you so much, Roberta, for walking us through everything you're doing to lower barriers and some of what you're seeing in South Carolina. It's really exciting. All right, I know we want to move right along, so Chris, I'll turn it over to you.
Well, thank you all, and I do not have slides, and I recognize that we're getting a little tight on time, so I will tell you that a lot of what you heard from Julia and Roberta were very similar to what we're doing in Kansas. I'll highlight a couple of the similarities and a couple of differences, and then I do want to get to Rebecca's question that was in the chat. So some of the similarities, Kansas similarly splits money between state fund and municipal. We have 75% of our money is governed by an 11-member opioid grant review board. That board, similar to Massachusetts, has lived experience, and I believe same in South Carolina, has lived experiences. They are subject matter experts. Similarly, we are targeting a lot of different strategic approaches. In Kansas, we've had multiple needs assessments. I'm sure most states have in the last few years, and we've identified a number of categories that have been priorities for the Kansas Fights Addiction Grant Review Board, colloquially known as KFAB. The KFAB has been focusing on areas of prevention, harm reduction, treatment, and recovery services in the last 2 years. This year, we transitioned into doing a long-term strategic plan. So to help develop that strategic plan, we had a needs assessment conducted through our University of Kansas. And we are working through the results of that needs assessment to develop a strategic plan, which means that we're going to be changing strategies from what we were doing was short-term, 1 year, small dollar grants for what we were calling immediate needs. And those were focused towards direct small funding to community-based organizations and a variety of different organizations across the state. There were statewide organizations. I think at least one state agency sought grants, but across all 4 of our grant periods, it was something to the neighborhood of, I want to say 80 to 90 grants were given for a total of around $20 million. I'm pulling up the annual report presently, but it was around $20 million in total grants that we allocated. That's kind of the state level. We are been focusing very closely on immediate needs and serving immediate needs in our communities. At the state level, we also, as part of our grant review process, we're targeting specifically smaller organizations with sub $500,000 budgets, specifically not-for-profits. And so we were trying to get dollars into those smaller organizations that may not be as sophisticated as the grant writing as the large organizations. I think both Julie and Roberta talked about the need to make barriers easy for our smaller organizations, our community organizations, to be able to have access to these dollars. And the way Kansas did that was by not requiring onerous evaluation metrics, efficacy metrics that constantly required detailed, extensive reports. Instead, we had our grant applicants identify SMART metrics that were their specific chosen metrics, both qualitative and quantitative, to evaluate the efficacy of the program. And then at 6 months and a year, they would write a report to us to explain how was the program functioning. Were we hitting those metrics? Were we hitting those targets? Where were things going good? Where were things going poorly? And that information is re-informing the board on subsequent grant evaluation choices. So that's kind of the state level. One other thing that I wanted to note that of how we've involved community organizations is in our needs assessment, we were constantly working with community organizations all the way down to the individual level to get a clear picture as to what services were out there, where are our gaps, what are the things that need to change, where are the things that are doing well that need additional funding. And you can find all of this on our Sunflower website, which I will make certain gets linked into the chat before the end of the day, because what we did again at the state level is we partnered with a health foundation that has a long-standing relationship with the Attorney General's office. You'll note I'm in the Attorney General's office as opposed to and an attorney as opposed to somebody who is an actual subject matter expert in addiction services, treatment, community health, those sorts of things. And the reason I'm able to do this job is because we've partnered with the Sunflower Foundation to bring in that subject matter expertise. And we have fostered at the state level a community, or rather an environment of multifaceted partnership. So what do I mean by that? I mean, the Attorney General's office, we partner with the Sunflower Foundation, who brings in community-based organizations who need resources, and we can then work directly in interfacing them with the state or them with our municipalities. We also work with an organization that's called DECA in Kansas that does our state naloxone program. We are routing certain product that we're receiving as part of the settlement agreement through DECA, and DECA has partnerships with community-based organizations. So we work with statewide organizations that have those connections to community-based organizations to help interface and kind of pull everything together and make certain folks are talking with each other. At the municipal level, 25% of our money goes directly to 205 participating municipalities. That's a lot of municipalities, and they range from our most populous municipalities in the 5 to 600,000 range to some of our smallest municipalities. I think our smallest recipient has about 130 people in the community. And that means that there's a wide range of ability to use those dollars. And so we at the AG's office, as well through Sunflower, do a lot of that technical support. It is maybe not so technical and maybe a lot more support than other certain approaches, but I do spend like Roberta, I'm on the phone constantly with my communities, giving them ideas, helping answer questions, directing them to additional resources. And to that end, we've also worked with Sunflower to develop additional, more detailed guidance for our municipalities. And this year we put on a conference back in April with the assistance of the Opioid Resource Network to educate our municipalities on how do you do that community need, that community evaluation of what is actually the need in your community. What are the resources that are available to you? We've tried to pull those things together so that folks who we're interfacing with, who may not have a public health officer, can identify still resources in their community, folks in their community, organizations in their community that can use those dollars. On the municipality side, I will give you full transparency. We're not seeing the utilization and the efficacy that we would like to see, so that's an ongoing project. I will probably be stealing Roberta's idea of the weekly coffees. It may be more like a monthly thing based on our availability, but I am stealing that idea because I think that will help continue to grow both trust in the state and the state partners, but as well as confidence in our municipalities to actually utilize the dollars correctly. To address Rebecca's question about how do we make the determination between funding a large organization and funding small organizations, part of that is somewhat dictated by our statute. Our statute, while it would be possible, doesn't really contemplate pass-through sort of grant making, financial agent sort of grant making, where one organization is then getting the money and then passing it down to other organizations. But part of it is that we are looking at statewide organizations that are doing that sort of engagement with community organizations and to some extent prioritizing those folks, because at least in Kansas, that's more effective than statewide organizations that are really only focused on their one particular mission. Sometimes that's really good, but other times it's less effective. But one of the things we're really concerned about is waste, right? We're concerned about overhead dollars being used in a way that isn't directly impacting or benefiting folks on the ground. To that end, at the state level, our Sunflower Foundation is limited to 5% administrative expenses, and so far has not tapped into any of that because they're using interest on our settlement dollars as a way to pay for the administrative expenses, and we're always trying to keep the administrative expenses low. So where possible, we would prefer to target specific community-based organizations doing project-based funding, so that we can try to minimize the overhead expenses that could lead to a reduction in the efficacy of the dollars. But on the flip side, that does mean we are looking at project-based expenditures, which may not be as effective for organizations that just need cash now to do a variety of different things. Our balancing effect there is that when we say project-based, that project could be expanding access to medical assisted treatment, and that be a very wide range of services that could be captured there. So our limitations aren't super intense. These aren't federal grants, right? That have all the restrictions and the strings. These are pretty, I will say, easy to comply with grants, but we are working in a collaborative approach so that folks are doing what we hope they will do, and not, going way afield of what the dollars are supposed to do. We're trying to strike a happy middle ground between making certain we're focused and effective while also not acting as a barrier to deter use. I think I talked for 10 minutes, and I would be happy to open up to questions since I know we're running out of time. Katie, you are muted.
Hey, Katie, you're muted.
Apologies. Thank you so much. Really appreciate it. And I thought maybe we could just keep going on the theme that you teed up here, which is continuing to talk through what are some of the considerations when thinking about whether to work through an intermediary for grant administration. I don't know if that's something Roberta or Julia might be able to speak to, but also that balance between making sure that you're being good fiscal stewards of the funding, but also working to lower those barriers that really might be unnecessary and might get in the way. So any ways that you think about that, striking that happy medium. Let's see, Roberta, can I go to you first?
Sure. We don't work through an intermediary. So the way that it works, especially with our discretionary funds, is that's just open to all. We don't say, although we've been thinking about, but we don't say you can have this much if you're doing treatment, this much if you're doing prevention, this much if you're doing recovery, right? We don't do that. It's just being kind of a, send us your application, it'll be scored, it'll be, a decision will be made. And then when the board reviews them, we supply the board ahead of time with all of the data for all of the regions, right? So we have 4 regions here in South Carolina. So, in the PD region, what is, the overdose rate, the poverty rate, all of that kind of census information, substance use information. So we do that for each region, and then they kind of look at the applications per region, and if it's just a university over in this region, they're doing research, but there's 5 others that are gonna, put boots on the ground, they're probably gonna put boots on the ground, right? So, they try to make their decisions that way, but we don't, we don't use a go-between. So really, it's just been, kind of send us your, fill out this application and get it to us because we want the money there. I wanted to say to Chris's point about the overhead, we have 5% administration is what's allowed, a 5-minute admin for all of our grants, because we do understand that you have to keep the lights on, but we also, think that this money should be not used necessarily for lights, right? And then we have only a 2% administrative that we take, off of the money. So We're kind of like, well, we keep it low, so we need you to keep it low. To that point.
Okay, makes sense. Julia, I'll give you the last word.
So, I talked a little bit about this during my presentation. For us in Massachusetts, using an outside party was just really a no-brainer. Our state procurement system is extremely complicated, and small organizations that don't have the capacity, that aren't traditionally funded, would not be able to compete at the level that some of the traditionally funded organizations that are regularly contracted through our Department of Public Health would be. And so it just made sense for us to go with an outside vendor. And as long as I think you have that partnership and really clear expectations about roles and responsibilities and dividing power, then, it really has been an ideal situation for us in the Commonwealth. So.
Yeah, great. All right. Well,
I
I know.
will say Kansas is not subject to that procurement barrier either, in the sense that for a grant that is given out, we don't have to go through the procurement process on there as long as the board is approving that grant. So know your state laws on that point.
Yes, same with us, no procurement, which has been a blessing.
Yeah. Okay, well, I know we're at the top of the hour, so thank you so much for these really detailed and helpful presentations. Again, please check out the toolkit, and we'll be sure to share all those links that were shared. So, again, thanks to our speakers and to everybody for joining us today. Really appreciate you tuning in.
Thanks so much. Bye.
I was just going to toss or somebody could toss my email into the chat. If you all want to ask questions about what's happening in Kansas, set aside a half hour, but you're always free to reach out.
Awesome. Thanks so much, Chris.